Ever wondered what gastritis is and how it affects your stomach? Gastritis is a condition that involves inflammation, irritation, or even erosion of the stomach lining. It's like a storm brewing in your belly, causing discomfort and sometimes pain. This gastronomic disturbance can sneak up on you suddenly, or it may decide to play the long game, gradually making its presence known over time. Now that you have an idea of what gastritis is, let's delve deeper into how our stomach is structured and how gastritis affects it. Your stomach is a fascinating organ, designed perfectly for its role in digestion. It's not just a simple pouch, but a complex structure with several layers, each serving a unique purpose. Imagine it as a multi-layered vessel, the outermost being the serosa, a protective layer. Beneath the serosa, you find the muscularis, responsible for the stomach's churning action that helps break down food. Next, we have the submucosa, providing blood vessels and nerves to the stomach. And finally, the innermost layer, the mucosa, a special lining that secretes gastric juices for digestion and provides protection against the stomach's own acid. This lining is not just a protective barrier, but a key player in the digestive process, releasing enzymes and hormones. It's this intricate design that allows your stomach to handle a harsh environment full of strong acids without harming itself. Now that we understand the structure of our stomach, it will be easier to understand how gastritis affects it. So how does gastritis wreak havoc on such a well-structured organ? Gastritis is like an unwanted guest that overstays its welcome, causing inflammation and irritation of the stomach lining. This inflammation can lead to the stomach lining becoming damaged and weakened, leaving it unprotected against the corrosive stomach acid. As a result, the stomach lining becomes more susceptible to further irritation and inflammation, creating a vicious cycle that can significantly impact the proper functioning of the stomach. Now, it's crucial to differentiate between gastritis and gastroenteritis. While both involve inflammation, gastritis is confined to the stomach, whereas gastroenteritis affects both the stomach and the intestines. This distinction is important because the symptoms, causes, and treatments vary between the two. Gastritis can be uncomfortable, but what causes it? Let's explore the risk factors and causes. Various factors can increase your risk of getting gastritis. One of the most common causes is a type of bacteria known as Helicobacter pylori, or H. pylori for short. This bacteria, found in the stomach lining, is often harmless. However, in some cases, it can lead to inflammation and eventually gastritis. Another common cause of gastritis is the long-term use of certain pain relievers, especially non-steroidal anti-inflammatory drugs, often known as NSAIDs. These medications can weaken the stomach's protective mucus layer, making it more susceptible to damage from stomach acid. Excessive alcohol use is yet another factor. It can irritate and erode the lining of the stomach, leading to gastritis. Age and stress can also increase the risk of gastritis. Older individuals are more likely to have H. pylori or autoimmune-related gastritis. High levels of stress, whether from major surgery, severe burns, or critical illnesses, can also contribute to acute gastritis. Certain autoimmune disorders can cause your immune system to attack the cells in your stomach. Now that we know what can cause gastritis, how do we go about treating it? Fortunately, treatment for gastritis is often straightforward and effective. Let's delve into the various options available. Firstly, medications are a common route to alleviate the discomfort caused by gastritis. Medications to decrease stomach acid, such as proton pump inhibitors and histamine blockers, are frequently prescribed. These help to protect the stomach lining, allowing it to heal and prevent further damage. For gastritis caused by a bacterial infection, like Helicobacter pylori, antibiotics may be required. A combination of antibiotics and proton pump inhibitors is typically used, disrupting the bacteria's growth and reducing the stomach's acidity simultaneously. Now, let's not forget about the power of lifestyle changes. A healthier diet can significantly improve gastritis symptoms. Incorporating more fruits, vegetables, and whole grains while reducing fatty, fried, and acidic foods can create a significant difference. Reduced alcohol consumption is also important. Drinking alcohol can irritate and erode the stomach lining and increase the production of stomach acid, which can exacerbate gastritis. Stress management too plays a pivotal role. High stress levels may increase stomach acid production, leading to an aggravated condition. Techniques such as meditation, yoga, and regular exercise can help manage stress levels. In conclusion, the treatment of gastritis involves a combination of medication and lifestyle changes. It's a condition that can be managed effectively with the right approach and consistent effort. Remember, if you're experiencing symptoms of gastritis, it's important to consult with healthcare professionals for proper diagnosis and treatment.